The Intercollegiate
Psychedelics Network.
My name is Hilgeman, and I recently graduated with my Master's of Science in Cell and Molecular Biology. And today I will be talking to you about the potential of psilocybin in the treatment of bipolar II depressive symptoms. So I wanted to talk through a case study of someone who exemplifies the point of this talk. So here's a picture of a teenage girl. What you would know just by looking at this photo of the girl is that she started experiencing depression around the time this photo was taken during her senior year of high school. She was baffled and didn't quite know what was going on, so she did what she could and sought help from her family doctor. This led her down a whirlwind multi-year path of medications and therapies that did little to alleviate her symptoms of depression. She was still struggling with bad feelings as she went off to college. She struggled throughout her academic time at college and even took a medical leave from college after a particularly heinous depressive episode. So she went home and started seeing a new provider to try and get relief from her symptoms. With this new provider, the rain clouds cleared and the sun shone to illuminate a revised diagnosis of instead of major depressive disorder, it was bipolar II disorder. Therefore, she started receiving a more tailored therapy for bipolar II specifically. The rain had finally stopped and life seemed to begin again for her after this. She graduated college and got her master's degree and is currently working at a hospital as a clinical research coordinator. This correct diagnosis was paramount to receiving proper support and treatment for her. What you might not know about this girl is that this girl is me. I struggled with what I thought was major depressive disorder for so long until a provider really looked at my symptoms and my history to shine light on the correct diagnosis. In my opinion, and I think it's very important to know that proper diagnosis is key, but with bipolar II, treatment can be complex and therefore novel approaches are needed. So what do you think bipolar disorder is? Is it someone being happy one minute and then upset another? Is it your crazy ex-partner and the descriptor you gave them after you ended your relationship together? Bipolar disorder is actually none of these descriptions. There are actually several myths that float around surrounding bipolar disorder, and this pretty much just leads to stigmatization of the illness, and the stigma not only causes people to be really misinformed about the illness, but also hurts people actively suffering from bipolar disorder. So I wanted to give you a little bit of detail about bipolar and in general mood disorders. So we know of unipolar depression, which is also known as major depressive disorder. But what most people don't know is that mood disorders kind of lie on a spectrum where we have unipolar depression at one end and bipolar disorder at the other end. And there are several types of bipolar disorder. There's bipolar 1, there's bipolar 2, and there's cyclothymia. So if we look at this chart here, you can see that the average person is the red squiggly line. So you have them where their mood goes up a little bit and it dips a little bit. When maybe something bad happens or something sad happens, their mood drops a little bit. When something good happens, their mood goes up a little bit. As you can see, their moods never really reach the lows of depression or the highs of hypomania or mania, as in bipolar 1 or bipolar 2 or cyclothymia does. So I want to talk a little bit more specifically about the two main types of bipolar disorder, bipolar 1 and bipolar 2, and kind of differentiate between the two of them. So in bipolar 1 disorder, the diagnostic criteria requires at least one manic episode, which is described as symptoms such as high energy, racing thoughts, and things along that manner. But psychosis is also possible, as in terms of a detachment from reality, or delusions or hallucinations can also happen during this heightened state of energy. And mania definitely can interfere with daily living activities. And hospitalization occurs typically during these episodes. But what is not required in a bipolar 1 diagnosis is a major depressive episode. Where in bipolar 2, you have a major depressive episode required alongside at least one or more hypomanic episodes. And hypomania is basically mania, but it's to a lesser extent. So you'll still have some of the same symptoms, but they're just not as impairing your daily functioning as much. It's more manageable. So 69% is the number that is the amount of patients who have a diagnosis of bipolar disorder who were initially given a major depressive disorder diagnosis. And this type of misdiagnosis is very dangerous because if someone is not receiving the proper diagnosis, they're therefore not receiving the proper treatment and the proper care that they need to deal with their illness. And this can cause a lot of difficulty for them and their loved ones. I want to go and talk about some statistics surrounding bipolar disorder. So there's 40 million people worldwide with bipolar disorder, according to a 2019 statistic. That is a lot of people. That's no small number. And I think it's also important to recognize some of the statistics associated specifically with bipolar 2 disorder. So you have 0.5% of people in the US will develop bipolar 2 disorder in their lifetime. People with bipolar disorder, specifically bipolar 2 disorder, are three times more likely to spend time depressed than they are in the hypomanic stages, which is important to know because then we know that people with bipolar 2 disorder are usually depressed instead of hypomanic. And so that is important to know for treatment. Additionally, 10 to 15% of people with bipolar 2 will complete suicide during their lifetime, which I think is a really harrowing statistic. And I think that's really drives my passion for finding better treatments for bipolar 2 disorders are these numbers and knowing that there are so many people out there suffering and that something really needs to be done for them to alleviate their suffering and bring them relief. So why am I focusing specifically on bipolar 2 disorder? There's a few different reasons. So first off, bipolar 2 is not simply a milder version of bipolar 1 disorder. There are two distinct illnesses that both need their own treatment options, but a lot of medications prescribed for bipolar 2 are really just medications that were initially tested in bipolar 1 and have not really been tested in bipolar 2, but they're just prescribed for people with bipolar 2. So people with bipolar 2 are not really getting a tailored treatment from research that is looking for their specific illness. They're getting medications that are tested for bipolar 1. So those medications really are not usually sufficient. Additionally, there are side effects and permanent risks associated with current treatments like antipsychotic drugs. With antipsychotic medications, there is the risk of tardive dyskinesia, which is a permanent movement disorder that can cause a lot of distress to patients and, like I said, is permanent and difficult to get rid of. Additionally, people with bipolar 2 deserve treatment options with emphasis on the options. They should not be only given one course of action. They should have multiple courses of actions available to them to pick from that best fits their lifestyle and their personal beliefs. So I want to talk a little bit more now about psilocybin in major depressive disorder. So there's been some research studies in the past few years looking at psilocybin's role in treating major depressive symptoms in major depressive disorder. So we have the psilocybin, pure compound given in a controlled clinical environment to someone who is dealing currently with depressive symptoms from major depressive disorder. And they found that this really results in alleviation of some of the depressive symptoms that these people have been experiencing. So we know there's psilocybin being used in major depressive disorder, but what about bipolar disorder? Is there any research going on there? So that leads me to my main question, which is, should psilocybin be considered for clinical trials to treat depressive symptoms in bipolar 2 patients? So I'll give you an overview of the table of contents for the rest of my talk. First, we'll talk about the benefits of how psilocybin could be helpful in bipolar 2 disorder. Then we'll look at some of the risks associated with bipolar 2 disorder and psilocybin and treatment options. We'll look at therapeutic considerations and looking at how our ideas surrounding bipolar disorder and psilocybin can create change. And then we'll end with some current research and where are we now with psilocybin and bipolar 2 disorder. So first, we'll look at the benefits of psilocybin for bipolar 2. So there would be less reliance on pharmaceuticals if we use psilocybin to treat bipolar 2 depressive symptoms. And I think this is really important to look at because pharmaceuticals are imperfect. They have side effects and are not an ideal option for everyone. So less reliance on pharmaceuticals would be great for some people. Additionally, we'd have less frequent dosings than current daily medications that are taken every day. A dosing session for psilocybin would be maybe every 6 months to a year, and that would be substantially less than taking a medication every day. We'd have fewer negative side effects, hopefully with psilocybin in bipolar 2, which I think would draw people towards psychedelics like psilocybin for treatment. Additionally, there'd be no long-term consequences from taking psilocybin instead of an antipsychotic pharmaceutical, such as, for example, for bipolar disorder, such as tardive dyskinesia that we've talked about previously. Additionally, a lot of people who have participated in research for major depressive disorder in psilocybin have reported positive therapeutic experiences, such as mystical experiences during these psilocybin dosing treatment sessions that have positively affected their view of life and how they feel about themselves and have had a profound impact on them. Next, we will look at the risks associated with psilocybin and bipolar disorder and why some people and some researchers are leaning away from this possible combination. So first off, there are unknown effects on mood. Since there hasn't been a lot of research into psilocybin and bipolar disorder and depressive symptoms for bipolar disorder, there's not really a lot of information out there on how psilocybin would affect someone's mood who has this disorder, which causes a lot of hesitancy with researchers in starting trials for bipolar 2 depression and psilocybin. Additionally, a bad experience during the dosing session might lead to overall negative feelings and be a bad experience for someone in general, and that could kind of set them on a not good course of how they view themselves and how they view the world, which is always a concern. And additionally, the major concern that I've read in research papers is that a lot of researchers are not wanting to study bipolar disorder and psilocybin because they're worried that it might trigger hypomania or mania in these patients. So really, psychedelics versus pharmaceuticals is really a balancing act of risk. We don't really know the risks associated with psilocybin and bipolar 2 disorder that well. So that leads to a lot of hesitancy with researchers about not wanting to look into doing trials with psilocybin and bipolar 2 disorder and the depressive symptoms associated with that. We know more about pharmaceuticals. Those are easier to test, easier to get clinical trials for. But at the end of the day, we're really just balancing which would be in the best interest of the patient. Next, we'll look at therapeutic considerations. So what would a treatment session look like if we were to do clinical trials with psilocybin and bipolar 2 disorder patients? So it would be in a controlled clinical environment with a psychiatrist or a psychologist present, typically a psychiatrist, and then a secondary person who might be a social worker, a psychologist, or sometimes there's also been reports of peer support specialists who are specifically trained in peer support and lived experience to be supportive of these patients undergoing the psilocybin dosing. So lab-grade psilocybin drug would be used in these dosing sessions. The patient would take the dose, they'd lie down on a couch or a bed in the clinical environment. They'd have eye shades, they'd have headphones playing calming or ambient music, and they'd have the support of both the clinical person and either an additional clinical person or a social worker or a peer support person. And they'd be able to talk through what they're feeling and what they're thinking or what they're experiencing during their psilocybin time. The frequency of treatments, as I mentioned a little earlier in this talk, would be probably every 6 months to every year. With maintenance sessions annually, ideally, and I think that that's a big selling point of this treatment. Next, I want to talk about general considerations for psychedelics and bipolar 2 treatment. So there's a lot of aversion to psychedelics and bipolar 2 disorder treatment. And my question is, why are people so averse to studying bipolar 2 and psilocybin? Kind of like what I've mentioned before is that there's really a lot of unknown risks associated with doing these trials, or researchers or physicians are not sure what those risks might even be, and they're a little too afraid to really just go for it and kind of set up trials and set up ways to kind of figure out what these bipolar 2 patients might experience if they do take psilocybin and if there would be beneficial treatment. But really, how reasonable is this caution? Because we have 4.4% of the US living with any type of bipolar disorder. So really, how many people are we leaving out of this research and of potentially beneficial treatments because of fear? Lastly, I want to end on some research that I found while preparing this presentation that I found to be quite impactful. So earlier this year in the Journal of Psychopharmacology, there was a paper published titled Risks and Benefits of Psilocybin Use in People with Bipolar Disorder. And basically this was a web-based survey that looked at people from around the world and their experiences with psilocybin, or as some people call it, magic mushrooms, and looking at how their experiences were and how they felt after taking them, and if they were helpful or if they were harmful. And I think it's really interesting because respondents, even those who experienced adverse effects from taking psilocybin, indicated that psilocybin use was more helpful than harmful. So we have people who have taken psilocybin, maybe not in a clinically controlled environment, but have taken this compound and who experienced depressive symptoms in bipolar disorder and other bipolar disorder symptoms, have indicated that psilocybin was more helpful than it was harmful, which I think is really impactful, because this kind of goes to show that maybe researchers are not correct in their thinking that it would be harmful to people with bipolar disorder to use psilocybin as a treatment option. Additionally, I wanted to bring light that there is a study on psilocybin and bipolar 2 depression that is currently recruiting in San Francisco at UCSF. This indicates that other people are asking the same question that I am. Why is bipolar 2 continually getting shut out of psychedelic research? And is it possible that there's therapeutic benefit in psilocybin for bipolar 2 disorder? This is a really important area of research that desperately needs more attention in the research community. And I'm glad that people like Dr. Woolley, who is actually one of the authors on the last research paper I showed y'all, are asking this question, and they're really being brave and really are at the forefront of this research topic, which I think is fantastic. So often I think of younger me, a girl experiencing debilitating depression, yet blindsided by periods of productivity and excitability. I felt very confused about my moods, yet was told time and time again that it was major depressive disorder and was given antidepressant after antidepressant. And these medications really yielded low results for me and just kind of put me in a worse state of depression and fluctuating moods. So misdiagnosis greatly affected my life. And I hope the mental health field gets better at differentiating between MDD and bipolar 2 specifically. And as someone with bipolar 2, I desire better treatments with less severe side effects. And I believe that psilocybin should be considered for all the reasons in this talk to treat bipolar 2 depressive symptoms. I think if we can envision better, especially better treatments with psychedelics, then we should really be looking into those options to look at creating novel therapies for those living with mental health disorders. Thank you.